Okay, so today we're talking about confidentiality, how we handle that with couples and families. And I am talking about the confidentiality between the clients and or the parents or any of the family members or anything like that, not the confidentiality with us. That confidentiality always remains the same. So with minors, and let me say that this is really up to you. There's no legal or ethical requirement to this other than the limits of confidentiality with to be able to break confidentiality when there is a danger to self or others, or there's abuse or neglect suspected of a minor, dependent adult, or elderly person. So with minors, you have the option to not offer them confidentiality at all and be able to share whatever the client talks about in therapy with the parents or guardians or primary caregivers. Now, I caution you with this because remember, confidentiality is the cornerstone of what we do. And so, with younger children, this is usually the way to go. But I have a policy that, 13 and up, actually now I think it's 12, it is 12, sorry. Our policy is 12 years old and up, that we give minors the exact same confidentiality as we do adults. And this is in the intake paperwork, in the informed consent, and parents have to agree to this in order for us to see their kids. So, because especially when you're talking about adolescents and kids, really, why would they, open up and share with us if they didn't know that their information was going to be kept confidential? Now, with that said, this can cause, a little dilemma because there are things that could come up in therapy that aren't necessarily, the limits of confidentiality where there are danger to self or others, or there's abuse or neglect, right? In those extreme circumstances. What about in other other risk-taking behaviors, like maybe, skipping school, or, having sex, or using drugs or alcohol, sneaking out at night, kind of like this kind of stuff that you think that the parents should be aware of, but yet you have these limits of confidentiality. So you could specifically, say that your limits for minors are, they do have it unless it's a risky behavior according to your clinical judgment. And that kind of leaves it open for you to be able to share with the parents. I personally still feel this is a little sticky because to me, and this is also subjective, but to me, my client is the child, the minor, not necessarily the parents. And so, and that's another decision that you have to make also. Who is your client, right? So, and that might make a difference in how you proceed with this. So with minors, what I'll do is I will talk to the minor client and about the importance of discussing this with their parents. And I will try to get their buy-in to either for them to discuss it with their parents or to allow me to discuss it with their parents. And I can tell you that, once you have a good rapport with the client, I would say probably 8 times out of 10, maybe, 80% of the time, I do get their permission for them to either, we talk about it in a session together, or they talk about it on their own with the parents, and then I follow up with the parents to make sure it was discussed, and the client does know that I am going to follow up with the clients and I have their permission to, or they want me to discuss it with their parents, just me and the parents without them there. So those are a couple different options that you can give the minor client. And okay, so in talking about the limits and confidentiality, with clients in couples and family therapy. So you have to decide for yourself. Again, there's no legal or ethical requirement to this. This is a personal decision. So you need to decide whether you're going to be able to keep confidentiality between the two parties or more if there's multiple family members involved, or if you're going to offer them all confidentiality. Now, if you don't have, a good foundation in your boundaries and you feel completely solid in boundaries, I would say do not offer confidentiality. A lot of people have, a lot of therapists have, oh, there's a term for it that I can't think of it right now because we don't offer it. But it is where, everything has to be shared with each other, that no confidentiality is offered between the clients. And so, and again, whatever you decide, this has to be spelled out in your informed consent with the intake paperwork before they even start. And I also verbally address this in the first session also, because the reality is some people don't even read the paperwork, they just sign it. So you want to make sure you also verbally make sure that they understand this as well before they start sharing with you. So we do offer confidentiality between clients. Now, again, you need to make sure that you have really good boundaries and are able to do this, because we've had some really sticky situations where it could cause maybe some conflict in clinical judgment even, if you don't have the experience and those solid boundaries behind you. For instance, one spouse or somebody might be cheating on the other. There could be where, I've had maybe some financial issues that the other partner doesn't know about, or, something with the kids, or, really, it could vary to basically something very minor to something very extreme, just with, lies and things like that. So you want to make sure that you're able to handle that and not break confidentiality, especially if you're saying that you're going to provide them with confidentiality. So really think about this. And I would say if you're just starting out, definitely let them know, offer like no confidentiality, and then the way you would normally proceed with that is same thing with the minors, is you would give them the opportunity, you would remind them of that they don't have confidentiality with one another, and give them the opportunity to talk to their partner or other family members on their own, right? Because that's the most ideal situation, is that they talk to the parent or family member, or not parent, a spouse on their own. Well, also with minors, with the parent. That's always to me the number one option. And then also you would follow up and make sure that they were told, and you would tell that client beforehand. If you're giving them the option to tell them on their own, let them know that you will be following up to make sure that they were told. So the other two options would be to talk all together, and then the other option is for you to just talk with the other client. And I leave that option up to that client who shared that secret with me. So but again, we choose, again, confidentiality, cornerstone of what we do. And we also see clients, which this isn't very common, but we see clients on as couples and individuals. We kind of rolled into this very organically. It wasn't necessarily a plan, but we started seeing clients and couples and families. But what normally happens is, the majority of the time, the problem isn't a couple or a family problem. The problem is an individual problem. So we found ourselves, like most of the time, recommending individual family with each party. So, and then that just rolled into us kind of seeing everybody involved together and individually. And it actually for us works out extremely well because we are able to see both sides of it. So the treatment has been much more effective. But again, this is very, very difficult. And, I do have over 20 years of experience. And if you've seen my earlier episodes of my history, it's very extreme type experience. So you want to make sure that you can handle this and that it doesn't cause you any sort of countertransference, internal conflict, clinical conflict, any of that. So if you're not sure, don't do it in the beginning. Refer them out to, somebody else for the individual or for couples or whatever you think is the best for the client. So same thing with the families. We do offer them confidentiality, but that's up to you, right? So again, in the beginning, take the path, the safest path for you. Don't promise anything that you can't follow through with, and make sure everything is outlined in your informed consent in the intake paperwork before you even start therapy, and verbally review these limits with them on the first session.